Please welcome to the stage Adam Berkowitz, founder, Simpara HR. Danish Nagda, MD, founder and CEO, Resilient.
Imagine the auto mechanic who can now afford their medication or afford their surgery because we fixed their health benefits. We put the patient at the center of everything. But the benefits are just one side of the equation. A year into this model, Schaefer has gone on to save just shy of $1 million. Across 180 enrolled employees, that's $5,000 plus per employee saved. That's the waste in healthcare. That's the waste. This wasn't magic. Imagine if every employer in St. Louis followed the lead that Schaefer did. St. Louis now becomes the most economically viable economy in the region. St. Louis is the example for everyone else to follow because we're fixing healthcare, right? Wages shoot up, unemployment goes down, R&D goes up, job growth skyrocket because we're putting the wealth back into the pockets of our local economy and our hard workers. And I love this quote. This was the CFO at our year anniversary. He said, "The outcome, both operationally and financially, has been better than I could have possibly imagined." This isn't hard. This isn't rocket science. Schaefer didn't invent this model. They're just the latest ones to do it. So how did they do it? The good news is there's a recipe. There's a formula for all employers that can follow to get to similar results. We have to understand that opacity in this healthcare system is the #1 culprit for the largest transfer of wealth this nation has ever seen. So we have to align the supply chain. We have to provide sunshine. It's the only disinfectant, right? We have to align our broker partners, our TPAs, our PBMs. We have to get rid of things that don't work. Co-pays and deductibles, they don't work. We've tried it for 3 decades, 4 decades now. They don't work. But the purpose of what we're talking about today in this conference is primary care and putting the patient at the center of this entire journey and this model. Healthcare is too much of a burden to fix just one company by itself. We're a benefit advisory firm in St. Louis. We are so lucky to have partners and co-conspirators in our corner. Danish is with me. He's one of the most innovative folks I have met in the healthcare delivery space. They have completely transformed what primary care can look like. And so I'm pleased to announce and welcome co-founder, CEO, Dr. Danish.
So before the slides come up, I wanted to tell you why an ear, nose, and throat doctor is at a DPC conference. And it's not for referrals, I promise. It's because my father actually used to work at a place like Schaefer Auto Body and worked his butt off. All 3 kids went to college. He was like many immigrants. Many of your patients might be like that, where he took care of his family but didn't take care of himself. At the age of 53, he had his first heart attack, had an emergency bypass that failed, moved in with me. I became his caregiver while I was in residency. And at the age of 69, he died. 40 years of the same employer, never had a primary care doctor. So if nothing else, I want you to remember that while my specialty and other specialists may not appreciate what you do, the reason why I'm building this is because of that. I wanted to make sure that was very clear. So what we're doing at Resilient is we're actually thinking about primary care and trying to give them a little bit more of a superpower feel. Because ultimately, one of the biggest challenges that exists in primary care is how do we deliver the doctor-patient interaction at scale? And the expectations of patients are changing. Your patients expect you to be able to, you messaging them. They expect telehealth. We all know this. We all went through COVID together. But what I will try to tell you is that there's a new type of care delivery model that's coming that will allow you to be able to grow your panels across the country. That'll actually allow you to be able to do physical exams, labs, and imaging completely remotely and still be able to deliver continuity of care. And in fact, I will try to say, and you can tell me otherwise after, that we will actually increase transparency of care. So what does omnichannel care in a remotely delivered healthcare system look like? Well, let's say that Dr. Smith is your new primary care doctor. They're available to you via messaging, via telehealth, or at any of our cloud clinics. We're building these cloud clinics in partnership with companies like Reef and other real estate partners. And these cloud clinics are physical brick and mortar locations where the doctor is actually on the screen. And all the tools in the doctor's office, the tools you all use every day, the stethoscope, the ophthalmoscope, the otoscope, we're actually connecting them to the internet and we're streaming it to you remotely. Well, to our current doctors remotely. And we also are able to draw labs right there. We have staff that can draw labs and do imaging right there on site. So you could actually do most of what you do completely remotely. Sure, we're giving up the doctor's touch. But I'll say that that trade-off is at the benefit of you being available at every location. We're building locations all over the country. Imagine your first patient in Austin, your next patient in Miami, the third patient in St. Louis. We're actually enabling that type of a healthcare system where the doctor can do everything they can do while maintaining continuity. And yes, there are situations where touch is needed, and then we work with partners to send those patients downstream. But with our new model and the data that we've proven, we're actually seeing that by digitizing the entire doctor-patient interaction, where there's a staff member that's there on site, and we've actually taken all the tools and connected them to the internet, we can actually do 90+% of visits. We have data on this. I'm happy to share what we're doing. And not only can we do primary care visits, but you can actually do sick visits for your patients and get imaging right there on site, all under a DPC model. Today, we have resilient doctors taking care of resilient patients at resilient locations. And we're in St. Louis, and we're now expanding to 3 states. And it's incredibly exciting for us. But it's also exciting because we're having deeper conversations about our role in the ecosystem. So just to kind of make sure that everybody understands what benefits consultants and brokers are looking for now, they are looking for the things they're mentioning: no waiting rooms, hopefully same-day appointments. But I will say that with us entering the market, a lot of them now understand the value of every doctor in the network, or every doctor being available at every location. Your patients at work and they want to go see their doctor, they can go to a cloud clinic near them. If they're at home, they want to see a doctor, they can go to the cloud clinic that's near them. It makes it so that continuity becomes incredibly accessible. And that is a really big challenge in today's market. Data shows, and that one, employees absolutely love this. I can tell you that the ROI that I'm going to show you would not exist without at least 30% of employees using. So I will tell you that the numbers that we're talking about only work with really high engagement. The NPS is 90. I think everybody's here's NPS is 90, but we do measure quite a lot on what the experience looks like. And I think for a model like this, if you're not thinking to yourself, I wonder how patients actually experience this, I think that's the first question that should come to mind, and that should at least alleviate some concerns. Happy to kind of trade war stories on what the challenges were. And we're taking the membership model way. Surprise, surprise, it works. You all know it works, but what if you could do it at scale? For every dollar that they're spending, they're saving $8. But that's only because 30% of the employees are actively utilizing the service. Enrolling is different. We all know that people can say, I'll opt in. But what percentage of them are actively attributing their primary care to you? Ask that tough question, and then that will actually fix the ROI, because employers and the benefits consultants that serve them are getting very savvy. I promise you they're getting incredibly savvy, and I'm sure Adam can kind of tell you about how. And there are new models that are coming out every day, and ROI is now the name of the game. And if you ever want to go from the 100 employees that you're serving to the 1,000 employees, and even greater than that someday, and build a practice that actually takes what you've built and the workflows that you've put together that actually could serve patients and take it to scale, and train other physicians. There's so many residents here that are looking for a home. If you're going to do that, you have to figure out a way to scale what you're doing. So that's what we're building. We're actually using technology to scale DPC. We're building a scalable infrastructure. We figured out the real estate aspect of it. We figured out the tech aspect of it. And we figured out the clinical aspects of it. And again, happy to have more discussions around that. But then we're also unbundling insurance from the equation. But we can't get rid of it completely, because the ENT is not on a DPC contract. So we have to work with them. So that's where we work closely with third-party administrators and benefits consultants. And that's something that I would say is actually a huge savings. Simple example: patient comes in with a mole. that mole looks slightly abnormal to you. If you're a resilient doctor, you're looking at it under a dermatoscope remotely. You're at home, you're looking at it remotely, and you're like, man, that doesn't look right. Let me send this to a dermatologist. Today, you hit a button, one button, and it sends it to a dermatologist, and within 4 hours, you have a diagnosis and a treatment plan for your patient already. We've reduced 80% of referrals. That's where those numbers came from. When you digitize the doctor-patient interaction, you save the employer money. And I'm telling you that it's better to save hardworking small businesses money than to go and try to save, no offense if there are payers here, I apologize, than going and saving buka money. And that's been our strategy from the beginning. So why am I here and why are we talking? I'm here because I love this community. It's my first summit, and I don't think I'm going to miss any more. But I think beyond that, we're announcing today that we're actually expanding access to our cloud clinics as we scale across the country with one of our partners. There was something in Fast Company about our partnership. And we're actually going to allow any DPC doctor to start seeing their patients and maybe even seeing our patients through resilient cloud clinics and through our infrastructure. So if you're interested, you can reach out to us on this website, or you can come up to me and I'm happy to explain what this means. But today it's resilient doctors seeing resilient patients at resilient clinics. Tomorrow, it might be you seeing resilient patients at resilient cloud clinics. And then ultimately, what we're really excited about is you seeing your own patients at our cloud clinics and being able to expand your reach to all 50 states as we grow in the next couple of years. But that's really where we stand and what we're building. I think we have time for some questions. I see that we have 5 minutes. We actually went faster than we were expecting.
There we go.
If there's any questions, there are people with mics, and please feel free to ask any questions.
A lot of us have patients who are underserved or disadvantaged or elderly with macular degeneration in their eyes, and they see black holes in the middle of whatever they're looking at. And I just wondered, like, how is this applicable to them if they might not have internet or a device or good vision? Does it work for them?
That's a good question. So that patient, so one of our customers is St. Louis County government. They've got 7,000 lives. They trust Resilient as their primary care solution. And they have many patients like that. They have many employees like that. And what's fascinating is that for that employee, telehealth does not work. I'm sorry, I know that's blasphemy to some people here, but telehealth does not work. But they can get transport to a cloud clinic, show up and sit in the chair, and just like they couldn't see you when they were in your clinic, perhaps they can't see so well in the other clinic, but we do a lot of things around building a digitally inclusive and also a clinically inclusive care delivery model. So what they do is they come down, they sit in the chair, they meet Holly, who's their cloud clinic specialist, who's a nurse, who's there as their advocate, and that nurse will then take an ophthalmoscope, put it in their eye, and we'll actually be able to see their retina on the screen. Now, maybe they can't see it so well, but at least they can take a picture of it and take it to an ophthalmologist. And so the idea here is that cloud clinic model, that in-person model, even though the doctor is remote, still allows that person to get the highest level of care. I actually truly believe that the digital divide has gotten much worse. And actually, telehealth could help solve the digital divide. But we have to be honest about the fact that it doesn't work for everybody. And which is why a lot of you are seeing patients in clinic again. I don't know if you had anything to add. No. Can't hear you. I don't think the mic's on.
Hello. Hello.
Hi.
Hey there.
My question is around multi-state licensing. Multi-state licensing, can you comment on that?
So every clinician, as part of this partnership, when clinicians and when doctors join as a strategic partner and they build their practice on Resilience infrastructure, we will take care of all of the licensing needs as part of that partnership. Because again, we have been doing that at scale for our own doctors, right? And so we know how to do that effectively, and we just want to do that so you can increase your reach. And I'll tell you where this whole thing came from. I think that's something that might help. So many employers are looking for DPC models, but none of the DPC models scale. And it's been a big challenge. And so we could try and go out and try to hire as many doctors as possible, or we could collaborate. And I think that all the conversations I've had with DPC physicians here, it's been pretty obvious to me that building up a panel base, being able to deliver care the way that they want to has been a little bit of a challenge. And so there's clearly a way that we can help each other. And that's so instead of trying to hire doctors off, and try to bring them into our model, we decided we'd rather empower them and actually allow them to build their own practices off of what we're doing. And then, find a way to partner together. I think we're out of time. Any other last questions? All right.
Thank you all.
Really appreciate it. Thank you.